So you have your towel clips. You're going to have your towels. And you have to make sure you don't turn your back to your back table and you stay 12 inches from things that are not sterile. So she's draping the patient. And one are all towel clips.
Oh.
Stand 12 inches from that. And I'm going to drape the patient, stand 12 inches from the bed. I have to make sure that I keep my fingers stuck. That making me very nervous. Okay. So I'm going to pull up my, yes. I think it's you.
Oh, I'm sure it is.
Okay, so you have to make sure that your Mayo is completely up to your bed. And then at this time, I'm going to give the surgeon something to do. So I can throw off my Bovie and my suction. And this holster doesn't have a container. Can somebody put for me a Bovie? It's probably one over there. I see one right on top.
A holder?
The other one.
That's good.
No, the other one.
This thing?
Oh, yeah, okay. I didn't know it had this on. So this wouldn't really happen. Like, I would really be getting it sterilely.
Scalpel.
And, hold on. At the moment. Hold on, Sergeant. Okay, so I'm going to throw off this suction tubing. And I'm going to make sure that I secure my cords. And I'm going to use this Velcro that's already on here. Okay. Now you can proceed to doing what you're going to do.
Scalpel.
Time out. This is the timeout. This basically tells you, make sure that everyone agree that this is the right patient, this is the right site, and everyone in the room has to, agree.
Okay, this is Sarah Lee with a hysterectomy.
Sarah Lee with a hysterectomy. So while she's doing that, I'm done. I'm gonna go and get my table. I have to make sure that this little nice 3/4 drape doesn't move. And make sure that the back table is all the way up to the Mayo. And at this time, I will be asking for local and irrigation from my circulator.
0.9% sodium chloride expiration
You can continue.
September 1st, 2012.
0.9% sodium
vascular
chloride,
pickups.
expiration date September 1st, 2012.
He has to pour it
Oh,
that
that's
way
what Bobby and
because the
Vasco
bottle
cups.
is contaminated, but the fluid is not.
Pasteurization 2%, expiration 8.
So he can't touch the bottle to the bowl.
2% bacitracin, expiration date August 1st, 2013. And you have to make sure that you label this stuff, and you have labels on your table. So with this, the local, you just stick the label up under the cup.
Meds, vascular pickup, please.
Yes, ma'am. And vascular pickups. And with this, you have to label your syringe. And you don't never want to label these numbers, because then you can't see how much you're drawing up. So I'm going to draw up. I'm going to get the air out. That's good. And I'm going to put this
Alpha
on.
retractor, please.
Yes, ma'am. For retractor. And so since I have nothing else to do because I've done everything but remove my sharps, get the sharps off of there, put them in the basin.
Long Oshner, please.
Step back there. Long Oshner. So I'm just paying attention to the surgery. You have to make sure that you keep your Mayo real nice and
Need a
neat.
tonsil and right angle, please.
I'm just paying attention to her. This is surgery, so it's so nice and smooth.
Curve Mayo.
You need help, Sergeant?
No, we're good. Specimen, please.
Specimen cut, please, circulator. I'll take it. Perfect. This is right over it. Frozen or permanent?
It will be
Sergeant.
frozen.
And if this instrument touched the cup, then you have to leave the instrument in the cup because it'll be contaminated. And that is frozen. You said frozen, right?
Yes, I did.
Frozen.
Suction irrigation, please.
And you have to watch your cords to make sure it doesn't go below the mayo.
Suture.
And my suture is already loaded, so I'll just pass it to the surgeon with a Addison pickups with teeth. And while she's doing that, I will begin to count. So I will start at the field, and I'll start with the laps. And before you count, you want to make sure that you have stuff kind of straight, because if you don't, then it's going to be kind of hard to count. Thank you, Surgeon. Have a nice day.
Great job.
Thank you. Okay. So at this point, I'm going to be straightening this stuff up. And then you forgot sponge strip. That's perfectly fine. Okay, and then I'll start to count. So laps 1, 2, 3, 4, and 5. Bratex 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Blades 1, 2. Needles 1. Hypo 1. Bobby tip 1. Then you start with your stringer. 2 curved mosquitoes, 2 4 curved crowds, 2 4 straight crowds, 2 4 Kellys, 2 3 Kelly longs, 2 4 Alice, 2 4 Alice long, 2 Babcocks, 1 Babcock long, 2 4 Oshners, 1 Coker long, 2 4 Leahys, 1 tonsil, 2 right angles, 1 Mets, 1 Mets long, 1 curved mayo, 1 straight mayo, 1 banded scissor, 1 2 ring forceps, 1 2 male hanger needle holders, 1 male hanger needle holder long, 1 2 3 4 knife handles, 2 Debakis, 2 Addisons with teeth, 1 Bonnie, 2 rat tube, 2 smooth tissue, 1 smooth tissue long. Then I can start with the basket stuff. I don't have anything there, so I can just count this. 2 Army Navy, small, medium, and large Richardson. 1 Balfour retractor with wing nut. 1 timeout. 1 full suction with guard. 1 Yankar suction with tip. 1 Gelfie. 1 bladder blade. 1 Sweetheart, small, medium, and large Deaver. Small, medium, and large malleable. Count complete. And then once you finish that, you have to take your sharps with you and put it inside of your needle box, and you will have to push back. When pushing back, it's very important that you do not move your drape. If your drape moves, you need to state it and fix the problem. And this will conclude the last 10 minutes of Mod 3 setup.